Good morning, it's Brian here. You are on the Art of Startup War. Now, what do we do here on the Art of Startup War? Well, many of you are already investors. Are your startups looking to emulate some of the greatest startups on the planet? But we take the companies that we invest in, only the best startups that we can find from all over the world. And we interview those startups. So as investors, as startups, you can listen to what they're building, how they've put it together, where they've built their strength from, and why we as an investor think so incredibly highly of what they can potentially to achieve. Now, obviously, the only reason that we are going to invest in a company is if we believe that company can build a unicorn and that they have something so special within their region that no one else can compete. No company is a better definition for than Pharmacy Mart. So Ahmed, welcome to the show, my friend.
Thank you, Brian. It's my pleasure being with you. And it's a great opportunity to give people a glimpse of what we are building here in the Egyptian market. Or let's say we are starting in the Egyptian market and building a huge thing for the entire globe. So this is our aspiration here.
I love Egypt because you get two regions for the price of one. Like you get the MENA region and you get Africa. Like you get both.
Yeah.
You get the fastest and biggest growing population on the planet, and then you get the other fastest and biggest growing population on the planet. Two markets which are prime for unicorns. And actually, rather than start with Pharmacy Mart immediately, let me introduce to investors why we see this region as such a hotbed of innovation and opportunity for unicorns. Right. So if we start off by saying, generally speaking, the unicorns in the United States are extremely difficult for non-institutional investors to be able to find. Why are they difficult? Because it's decided by the biggest investors in the world who they want to be unicorns, and then they give unicorns to their friends' children for birthday presents. That's kind of the way it works. Now, what does that mean for you as a smaller investor or a mid-sized investor? The chances of you getting into that is extremely small. The Facebooks, the Twitters, the Squares, the Stripe, the history has already been written and you are not a part of it. However, very, very, very interesting times we live in. So we've seen regions like the MENA region, Africa, India, absolutely explode with unicorns over the last 2 to 4 years. The expectation is that the unicorn hunt is going to be far greater over in these regions than it's even going to be in the United States over the next 3 to 5 years. So if you are a mid-sized investor, if you are looking for companies which can exponentially scale with extremely low expansion rates or costs to actually scale, but massive upside whereby the valuation of the company is the same as the United States after Series A, this is where you should be looking. So today we're going to give you a little bit of an intro, not just to an incredible company building their own unicorn that we have invested into, but also into the region and why the region is so powerful. That's it. Would you add anything to that intro,
Yes,
Ahmed?
sure, Brian. So you're totally hit it that this is a very potential region. So I'll start with Egypt. Actually, Egypt is the largest pharmaceutical market as a size in Africa. So it's the largest market in Africa, as well as expected to be the fastest growing in the upcoming 5 years. So it is the largest and even the fastest in the growth. You're talking about 100 million people taking medications, eating and stuff like that. So it's a very huge market. And even if you have a look on the most large or highly valuated startups here in the region, it's mostly in the B2B space. So the B2B space here in the region, it is going nuts. A lot of startups are having good or great traction in this region, but yet the pharma industry is yet untackled. So we see it as a great opportunity, and it's a great opportunity to start at Egypt and then to expand to, as you just mentioned, that Egypt is part of the MENA region as well as Africa. So it's a great point to start and then expand to Africa as well as to the MENA region. So this is let's say in a nutshell, a view on the market here in the Egyptian pharmaceutical market.
Wonderful. So you're sitting there in the market. You know you're in one of the hottest markets in the world. You know you've got a huge issue within the pharmaceutical space. Bring us right back to the beginning of the genesis of Pharmacy Mart and where the idea came to you and you realized there was this huge problem that needed to be solved.
Yes, yeah. So actually, as being a pharmacist, I've been in this industry for the last 12 years, working on different companies. And different people, actually, as a pharmacist, different people reach for me that they are searching, for example, for a specific medication and they couldn't find it. Accordingly, you as a pharmacist, you are using your, let's say, connections to find this product. So when I got in depth for this with my friends, the pharmacists, actually my colleagues, this is due to the inefficiencies in the supply chain or the connection between suppliers and the pharmacists, mainly based on manual connection, based on phone calls, and it's very, very primitive. Accordingly, everyone in this supply chain is working in silos. Accordingly, this impacts the availability of the products to the patients at the end. So at this point, I looked at there is a clear gap in this, or there is an issue that needs to be solved, and an interference that needs to be done in this space. Accordingly, at this point, I started to have more in-depth on the practice in the market, and if there is already a solution for this, and I was amazed that there is no one working on this space. And after starting, let's say, having the preliminary analysis, I found that this model is extremely successful in the FMCGs. So this is, let's say, another parallel industry having the same, let's say, the same issue, but yet they are advancing and they are having a great presence. Accordingly, at this point, I had or took that decision. I need to start this, and I need to implement this idea, and going with this idea and implementing it, and support patients and support pharmacies in order to ensure that the medications will be available in the future for those patients. So this is how it started, actually. Yeah.
And if I could paraphrase a little bit, so, pharmacies for me are a little bit like accountants and attorneys. And back in the day when LegalZoom over here, which many investors will know, came into the attorney world, and they said, wow, look how old-fashioned and traditional the attorney space is. There's no convenience in there whatsoever. Like, you have to go to an attorney. You have to spend the money there. It's tremendously expensive. It's a horrible experience. And really, it hadn't been changed for 50 to 100 years. And then they came in and they brought in innovation, and as did many, many, many other firms since that moment. Same thing has happened within accountancy. And within pharmacies, it hasn't really happened. Now, over in the United States, GoodRx did a little bit. They decided, let's bring some convenience to the market, and let's actually have the drugs being taken out to the people where that they need it. But it's only one tiny, tiny, tiny segment of the pharmacy space. So I think every investor listening will fully understand, wow, pharmacies, traditional, old-fashioned, very manual, hardly anything digital built into it as well. Huge area for innovation and for disruption within there. Now let's talk specifically, as you sat back and you realized all of these things. You have been in the space, so you've got tremendous domain expertise within the pharmacy space. What were the lowest hanging fruit areas that you said, this is what we're going to approach first, this is what we're going to fix?
Yeah, so the first, there is a lot of problems, but yet it is the connectivity. There is a lot of issues from connecting suppliers with the pharmacies, as well as, let's say, financing issue for the pharmacists, as well as logistical issues. But yet the key point that we started to tackle is having a marketplace that connects the key players in this supply chain, the suppliers and the pharmacies. So this was actually the starting point, and the key pain point that we saw that this will attract and will solve a huge problem for the pharmacist. Accordingly, we started with this, and then we complemented the let's say the product with other value-added services in order to ensure that we are having an end-to-end B2B solution, not only a B2B marketplace. So while we developed it, we developed it in order to tackle all the problems that's facing the pharmacist, from the availability of products and having the procurement part, as well as the financing and logistical part. So this is how we did it different. And accordingly, of course, this impacted the acceptance of the idea and even the traction. So that is a very important point. But yet the low-hanging fruit, of course, it was the automation of the procurement and the connectivity between the supplier and the pharmacies.
Yeah, and it's highly interesting because if we look at Amazon and how Amazon evolved from where they started out, like many people look at Amazon and say, oh, well, we can just buy stuff on Amazon. But investors look at Amazon as the ultimate solution for the supply chain, because the supply chain is so broken and so difficult, and going from where it was before, where the goods come from, where the drugs come from, and then go through to the pharmacies and then get dispersed out to the consumers. And every single part in the middle of that, from the payment, the recording, the transactions themselves, getting the right drugs to the right places in the most efficient way at the right time. All of these are highly complicated, and especially when you're talking about huge regions with massive geographies to get it across. One thing is saying this, Ahmed, but another thing, like just how I explained it there, is the magnitude of what you're building is so huge. How did you go about building it?
Yeah, let's say we measure the impact by different parameters. The first parameter is the number of pharmacies that we are serving. But yet we don't look at this part only, but we look at the number of, let's say, population that's served by this or those pharmacies. So this is how we calculate our impact, or what's the size of the population actually that we are easing their life or impact the availability at their side. So what we are trying to do as well, it's not only about optimizing the logistical part, but yet having a seamless connection between the suppliers and the pharmacies. So for example, there is an thing that we are launching soon, which is an express delivery. Accordingly, if a pharmacist wants a specific medication for a patient, so it will be available within 1 hour. It will be available at the pharmacy. So this is, we are taking it to the next level and having a seamless network between the supplier and the pharmacy. So this is how we think about it, and how we need to solve it. As actually, we are part of the population, and we already faced this, that you are searching for a specific medication and you are going for multiple pharmacies to acquire it. Accordingly, this thing that needs to be solved. And in some cases, for example, in some cases, a mother that's holding a baby and searching for a medication for her baby, this is a huge burden on this person. Accordingly, if you supported this person and somehow ease this already painful process, you are adding a lot to their life. And of course, this is actually felt by the pharmacists, and there is a huge need in supporting the pharmacies in order to do their role in the healthcare system. So this is what we are trying to do, as well as, of course, there is another things, which is supporting them, let's say not financially, but the fintech has been a huge thing in the region as well. But yet the fintech didn't tackle this sector. So we are the gate for the fintech to be also tackling this industry or this space. So this is another parameter that we're looking at, that we're helping the patients as well as helping the pharmacists. So that's it. Yeah.
And the wonderful thing about attacking the entire supply chain is that very much like Amazon, do you become a bank? Do you become a cloud company whereby you're keeping data for the pharmacies there? Do you become the supply chain logistics? Do you become the immediate, we'll have deliveries to you within 1 hour and give you your pharmacy Mart Prime? Like, you can create all of these different industries which all sit inside the same pharmacy chain. And just going back to the fundamental problem that you're solving, I love that you painted the picture of the mother with her child at a pharmacy. The pharmacy doesn't have the drug that the mother's looking for, which is highly usual, not unusual. Then the mother thinks, crikey, does one of the other pharmacy chains within one of the other pharmacy shops within this chain actually have one? Well, a lot of the times they don't even know that because their own supply chain is such a mess. And then, of course, you've got multiple other supply chains, and forget her about her ever knowing to know that. So your solution of saying to her, there's a coffee shop right down the road. Why don't you get yourself a cup of coffee and relax? Come back here in an hour's time. Have exactly what you're looking for, is a tremendous solution, not just for her, but also for these poor pharmacy chains who are running around the place trying to manually solve this problem that never goes away.
Yes, yeah, it's a huge problem. And I would like to highlight another point that coming with this comprehensive solution, it's mainly not only mainly my experience is in the pharma industry, but yet the other co-founders are coming from different backgrounds. So this helped us a lot to formulate this formula. Other co-founders are coming from operations background as well as fintech and communication background. Accordingly, we complemented the idea about the domain expertise or the domain expertise of the different co-founders in order to have this, let's say, successful formula that we launched in the market. And currently, as we speak, we are in the first phase or the pilot phase geography as we speak. It's a huge, it's a large city actually, which is with the population of 7.5 million people. But yet currently as we speak, we are more than proud that we reached almost 30% of the pharmacies at this city. So as we speak, in average, we impacted the life of 2 million people. Actually, we improved the availability of medications to almost 2 million people. So we are so proud of what we have been reached till now. But this is still our starting point. We are learning a lot and adding a lot of value-added services to our product. And this space is still in the very, very early stages of the digitization, but yet we are here to take it to the next level in let's say convenience and digitization. So that's it. Yeah.
Incredible. So, when somebody listens to me speaking about you and constantly comparing you to Amazon within pharmacy, and you talking about 30% of all pharmacies in one of the largest cities of the country actually already having that implementation, they would be forgiven for thinking that this has been a really easy journey. So that is never the case because you got to give some blood, sweat, and tears here. And if you could share a little bit about the early journey, especially the time when you realized this was a problem. And by the way, you're not the only one who realized this was a problem. Like every owner of every pharmacy everywhere across Egypt must have realized that this was a huge problem. But you took the step and said, I'm going to fix it. Talk to me about how you built your team. Talk to me about how you built the product, the marketplace. Talk to me about how you made it work in those early days when you didn't even have the technology to provide everything that you wanted to.
Yes, yeah. So starting with the beginning of the journey, so I just mentioned, it is a clear unmet need. I see it as a great opportunity. So I started formulating, let's say, complete business plan without knowing what I'll be doing with this plan without having any co-founders. I just have the in-depth analysis of everything in the market in order to be ready. And I don't know what will be the next steps. And then after formulating that preliminary business plan, I somehow reached for our different co-founders in order to somehow pitch them the idea of having already the plan and give them the assets as they are coming from outside the industry. Accordingly, they need to be somehow onboarded on the industry at the beginning, and then what's the key issue. So this is all the next steps, having different let's say co-founders with different backgrounds. So from day one, I searched for people that would complement my experience. I didn't search for someone coming from the same background. So this was the first point I searched for. And then after having the team, we started having more in-depth plan, and then we started doing or going in depth for the tech part, or starting our let's say MVP, or building our MVP. We searched for the, let's say, or we will got designers, the best designers even globally, not only in the Egyptian market. We from day one we have a vision that we are building this not for the Egyptian market. We are building it for scalability and building it to be the best in class. So we from day one we had this vision. Accordingly, we selected the talents to develop this on a global level, actually. So once we got for the let's tech team and the designer, we started having in-depth focus groups with the pharmacists in order to have more in-depth insights about their daily challenges, their daily journey, and all the in-depth analysis on the steps they are doing in order to do the procurement part. And then we formulated our let's say platform in order to serve those needs for the pharmacists. So it's not built from our own ideas, it's built from insights from the customer. So I see this is a clear or a very important factor that leads to the high acceptance, as it's already came from them. We are not developing a thing and we're trying to convince them with. So this was the first step. And then where the key challenge when we started, it is having let's say acceleration in the both sides of the, let's say, the supply and the demand. So at the beginning we only had one supplier, we only had 500 SKUs as supply. Accordingly, the acceptance from the pharmacies was not that much, because you don't have a huge variety of products. But after a couple of months, we had or onboarded more than 20 suppliers. We had 4 out of the 5 top suppliers. And currently, as we speak, the game is changing. Even suppliers are reaching for us to be involved. So this is how the perseverance and even the consistency gave us another dimension that we didn't even thought about that when we started. That you need to reach for suppliers, stuff like currently as we speak, we have a lot of requests from suppliers to be included at our platform, as well as a lot of challenges that we faced while we have our MVP. For example, when we launched it, we saw that all the pharmacies will use our platform on their desktops that's available at the pharmacies, but yet we was amazed that over 60% of the pharmacies actually still use the platform on their mobile. Even it's a huge thing that they are doing the procurement. Accordingly, we adapted our design and all the flow to be both for the mobile and for the desktop. Yeah, this is where a very important point, and a very small tricks that leads to higher acceptance. For example, a lot of pharmacists don't even remember their email. So they register, and after a while, why you didn't order in the follow-up? Because I didn't remember, or I don't know how to reset my password accordingly, because I don't have an email actually. So we added an option of resetting the password by the mobile, for example. So this is how we adapted to the behavior in the market and for the pharmacists in order to be a very friendly solution for them. So this was the journey. As well as while we started, actually, we had good share of voice. This is a very important point at the community of the pharmacists. You are building repetition day after day. Accordingly, this helped us a lot in going to the next level and even acquiring new form number or new pharmacies, as well as was actually internal challenges of who the team that you will let's say hire and be the successful formula for it. They are building a new thing. Accordingly, we started with changing different sales teams, for example, as you are trying different people with different backgrounds and different experience till you got the right formula that you need for this type of product. So that's it in a nutshell, the challenges that we faced in the beginning, as well as, of course, we didn't have, let's say, value added services like the financing, for example. um, we started with cash payment, but yet currently as we speak, we have one of the top 3 banks at the Egyptian market working with us, as well as the leading fintech app in the region, as well as we have partnership with Visa International on the regional level. Accordingly, we are lucky enough that even we are startup, but yet we are coming from different top multinational companies. Accordingly, we have this mindset integrated in our DNA for a couple of years. So we are having partners in this level. We are not going for, let's say, suboptimal technologies or suboptimal partners. We are not going for this. Yeah.
Very good. And then, so just before we get to the traction, which I really want to get into, like how you built up the traction, because everything everybody has heard so far is that, like every other company that's coming out with a great innovation, you're faced with having to build belief in everybody around you. You're faced on having to build it within your team and the team that's being built, because you're saying, well, you should not take that safe job over here. We're going to change the world. You should come with us. And we're going to make sure that in the long run, you're going to make so much more money and your purpose is going to be higher. You have to change the belief of the pharmacist. And they've done things in the same way for many, many, many years. And you're telling them, no, it will be different if you do it with us. And all of the partners and everybody through the entire chain. And I want to get to how you successfully turned this from being an idea, a genesis of a thought that would change the pharmacy world, to how you actually drove traction with actually very little investment at the beginning, which gives us the potential of where you can go to. But before we get there, talk to me a little bit about the team. Talk a little bit about the domain expertise of the team that you now have today and why it's the most powerful force in the world for building a unicorn.
So starting with let's say with myself as part of the team, I have been working for let's say over 12 years in the pharma industry. I was lucky enough to work at 3 of the top 10 pharma companies. So this is a mix of learning from different schools, huge schools actually in the pharma industry, as well as working at different functions, having experience in sales, in marketing, market access, pricing, public affairs. It is, let's say, a very good diversified experience in the pharma industry. Accordingly, this supported me a lot in the let's say, understanding of different dimensions of the market and different and assessing different, let's say, hurdles in the market, and having a good comprehensive view on the market, not only on the Egyptian market, but during those 12 years, I had overseeing projects on the regional and even with the global team. Accordingly, I have exposure to other markets as well. So this is, let's say, the experience through the 12 years. And I was lucky enough to work at positions which is not a lot of people work at this position. So, for example, that if a company of 1,000 employees, there is only one person that's working as market, and was lucky enough to be this one person. Accordingly, it's not only about the experience, but yet the type of experience in the pharma industry. So this is the thing that I'm lucky to have this experience. Of course, the other co-founders are having amazing experience of over 10 years in different industries. For example, Mazhar, he came from the telecommunications background. He was one of the key team members who developed Vodafone Cash, which is the leading digital wallet in the Egyptian market, as well as his experience as a business development and strategy manager at, let's say, actually the leading telecommunication company at Egypt, as well as one of the leading telecommunication companies globally. So this is gives us a very value added in the fintech or the financial aspect of the project. So this is an important point. The third co-founder actually came from the operations part. Haitham worked at Vodafone and then worked at a couple of top startups here in the Egyptian market, from Halan, which is just raised 124 or 125 million US dollars, as well as Capital, which is as the same idea or in the B2B space, but yet in the FMCGs, and they are valuated over 500 million US dollars as well. So he came with a mix of background in the operations from the top multinational companies, as well as a couple of top startups in the Egyptian market, as well as the region. So this is a mix of experience of people having different backgrounds, as well as the fourth co-founder actually is coming as well from the pharma industry, but yet he have experience in the retail part as well. So I have from the pharmaceutical companies part, you have the pharmaceutical as well as the retail experience. Accordingly, complementing those expertise, we came up with this end-to-end B2B solution, rather than having or tackling a specific or a single point that will not be, let's say, there is, let's say, a thing that if you are not changing the current solution by a huge margin or a huge multiplier, you will not have a great acceptance. Yeah. So this is what we thought about, that we need to somehow having a huge product or a huge solution for all their challenges in order to have this shift. So this is how we think about,
Wonderful. And then so in the last 5 minutes, I really want to focus on the traction that you've had since you've started, and then moving in towards the projections that need to be built. So talk us through, I do want to really underline before we go into that for all investors listening, if you invest in one founder on their own, it's very challenging. It's not very challenging because the pressure, the time, the ability, it's one person looking at it. It's just really hard. For one founders to be successful, it's highly unusual. When you take 4 founders that have such tremendous domain experience, you've got 4 lives, 4 sets of heartbeats, all dedicating everything they have to this being successful. You have this huge experience which goes across all of the different sectors, which goes across all of the different industries and specialities within those industries as well, all throwing themselves at this. So this is a rock star team that we at Expert Dojo invested in. But talk to us, Ahmed, about what you've done so far, type of revenue that's coming in, and talk to us about what you're raising, how much you're going to raise, and then what that's going to do for the revenue going forward, and really paint that path with the epic insight into what the unicorn looks like.
Yes, sure. So actually, as we're speaking, we had the closing of the year, so it was started. Let's say, as just mentioned, that the challenges at the beginning, currently we are operating for 1 year. We closed the year with over $2 million as GMV. We see it as a great milestone for us since we started, as well as we are having more than 30% of the pharmacies at the pilot phase or the city that we already operating at. And for the revenues, actually, it's 5% of those GMV or the GMV. So those are the key numbers, but yet it's just a starting point. For let's say the projections, the good thing I would like to give you an essence on the history of the let's say the customers. So currently as we speak, the average revenue per customer almost doubled that since we started. So it's not only about the number of acquired customers, but yet the pharmacies are more dependent on us on their supplies. It's almost doubled since we started per pharmacy. So this is a very important parameter
Mm-hmm.
as well.
Mm-hmm.
And for the future, as just mentioned, we are operating at Alexandria, which is representing almost 10% of the market. So actually, if we did the same thing in Egypt, we are forecasting for the upcoming year to reach more than 30 million US dollars as GMV. So it is very achievable as we already did it. And we had a lot of up and downs actually as this is the first year. But yet in the future, we see that having more in the upcoming year, expanding to different regions and having a GMV of over 30 million US dollars. But yet in the next or the second year after this, or actually it will be the next year from now, we see that we will have more than 200 million US dollars as GMV. As there is
Amazing.
a great opportunity in this market, as well as in the upcoming year, we will start expanding in other countries as well. So it's just the beginning. It is a huge market. We are talking about this issue. It is not only for the Egyptian market, it is in the emerging markets, the entire emerging markets globally. We're talking about 310 billion US dollars markets. So it's a huge undigitized market. And we see that, of course, we will have a great impact in this, in delivering the right medications for the right patient at the right time.
Yeah, you're talking about all medical distribution amongst
Yes.
the entire region and beyond. It's huge. And just in the numbers that you've said there, you're talking about 1,000% growth from what you did in 2021, which is pretty much when you started out, to what you're going to do in 2022, which is monster growth, and it's right on track for a unicorn. How much are you raising now, Ahmed?
Yeah. So currently we're raising 1.5 million US dollars
Mm-hmm.
as our first round of funding. We are happy to receive our first investment from Expert Dojo. So it's our pleasure, and we see it as a great value added for us. It's not only about the investment, but yet currently as we speak, we have multiple commitments in this rounds,
Amazing.
and we are it's going great. And we are expecting to close this round by the upcoming couple of months, to actually 2 months from now, to be finalized. So
Excellent.
actually, as you speak, it's almost 40% occupied.
Beautiful. So so anybody listening to this, look, we've pretty much going to close out the round by the end of the quarter, which is quarter 1 this year, and then the company just goes to war. And if you think about what they've achieved with virtually no investment put in, 4 co-founders throwing themselves at this, they went into their first market, they took 30% of that market straight away. There is no end to what can be created here. The only thing we have to make sure is that we raise the money nice and quick so it doesn't become a distraction from the natural growth that this company has already got going through. 1,000% growth, nobody can ask for anything more than that. There's hardly any unicorns that have been growing at that level even before they became a unicorn. Ahmed, I couldn't be happier that we made an investment in a pharmacy Mart. We love the company, we love the founding team and what you guys have built. We're with you all the way until you take this thing to unicorn status. And just congrats on it all. Can you give everybody your email address so they know how to contact you afterwards?
Yes, yeah. My email is Kadous, Kadous, at pharmacymarts.com. So this is my email, and I'd be more than happy to receive any questions, yeah, or
Yeah.
requests.
Perfect. PHARMACYMART.com. And then you can also always email me, Brian at expertdojo.com. Thank you, Ahmed. Let's build a unicorn, buddy.